we are just going to go ahead and get started. We are so excited to have you all today at our second Innovation Hub Learning Community Webinar series of this year. This one is kind of a fun one that we're going to be engaging with you all with today. And so it's titled Stop Building the Plane as We Fly It, Being Intentional with Strategic Planning. And so I will be joined also later in the presentation by my colleague Laura, who you all know from previous webinars has led a lot of the Innovation Hub Learning Community webinars. And so she'll be exploring some information about how we can be more strategic when it comes to building out your strategic plan. So just to give you a little bit background, we always start off by explaining a little bit information about the webinar series. And so this webinar series focuses on skills and strategies you can apply to your work to improve your organizational processes, expand the scope of your practice, and plan for program sustainability. These webinar series are open to everyone and not just Innovation Hub practices. So today we're going to be focusing a little bit more about tools that you can use to implement in your strategic plan and building out your strategic plan or even building from a current strategic plan that you have. And so by the end of this webinar, you should be able to understand the importance and benefit of strategic planning, including defining success and goals. You'll be able to practice applying aim statements and key performance indicators, trees to support your organization in developing and tracking progress towards your strategic goals. And lastly, you'll understand how key performance indicators and the theory of change can strengthen strategic foundations and define key aspects of your work. So to give you a little bit overview on our agenda for today, we're going to spend the first couple of minutes really giving you a refresher on key performance indicators and aim statements. If you joined us at some of our webinars last year, you'll see that this might be a little bit familiar. We provided a presentation on key performance indicators and aim statements. And then next, we'll talk about connecting some of the key performance indicators to your strategic planning. We'll also have Laura explain to us how you can think about connecting some of your key performance indicators in your strategic plan to the theory of change. And then lastly, we'll have time for questions and answers. At any point, if you have any questions, feel free to either pop them in the chat or you can pop them directly in the Q&A tab, which you should see next to the chat box. So this is just the layout. Like I said, again, we'll talk about aim statement, then we'll go into key performance indicators and then relate that back to theory of change. So throughout this presentation, we'll be referencing this case study and applying some of the tools that we'll be talking about today. And so I want you to remember some of the information from this case study, but just know that we'll also be referring to it and repeating it back to you. And so the case study reads, you are the director of programs at a doula service organization tasked with adding a new goal into the 5-year strategic plan. The new goal was initially developed to address a concern on the low attendance rates of postpartum visits reported by 5 partnered hospitals. The goal will focus on identifying how your organization and providers at 5 hospitals can leverage partnership to increase the number of postpartum visits attended by your clients or new parents. Your objectives will address how the organization plans to increase the number of postpartum visits clients attend in the 2024 to 2025 year. And so let's get started at the aim statements. Let's dive into really how aim statements can help build onto your strategic plan or help you even build out some of your strategic plan. And so what is the aim statement? An aim statement really is a clear, explicit summary of what you hope to achieve over a specific amount of time, including the magnitude of change you'll achieve it in. When we think about an aim statement, a good aim statement should really capture the voice of the collaborators or really the ones that the population in your program is seeking to impact. And so when we talk about collaborators, this could mean, in our example, we are talking about collaborating with the partner hospital sites, but also collaborating with some of our clients. And postpartum doulas, or we can think about collaborators as internal staff members. A good aim statement should also be providing alignment of multiple perspectives. It also helps keep the team focused on the task at hand, and it creates the urgency to accomplish the goal. And lastly, it really provides a vision of what success looks like. And so here you'll see how to build out an aim statement. You'll use this template. And so it goes, we aim to accomplish what? And so accomplishing what, that is where you will tie into the pieces of information that really get into why your aim statement is being built out, or why you're including this specific strategic goal in your strategic plan. And then, because why is it important, with and for, like I said, those are the collaborators or the population your program seeks to impact, and then by the time frame for the project. And so when you're thinking about aim statements and you're trying to relate it back to how, excuse me, how it relates to strategic plans, you can really use it in your strategic plans to describe aims for a specific activity for a program or an overall goal and objective. You really want to remember that aim statements are meant to be high level. You don't want to list out all of the activities in your aim statement, because you'll see that through your planning, the aim statement will help and guide you in figuring out what activities are needed in order for you to accomplish this goal. So if we think back to our case study, we said that the goal to be added to the strategic plan will identify how your organization's current relationship with providers at the 5 partner hospital sites can be leveraged to address the low postpartum well visits by some of your clients. And so looking at this aim statement structure, we said that we aim to increase the percentage of clients receiving postpartum doula services because providers at 5 partnered hospital sites are reporting low numbers of attendance at postpartum well visits. To do this, we will collaborate with new parents, postpartum doulas, and providers at 5 partner hospitals and identify any barriers of care by the end of the 2025 period. And so you'll see here, we've described what we aim to accomplish, why is it important that we're accomplishing this. We've also described who we plan to accomplish this with and the time period in which it will be accomplished. And so we really want to use an aim statement to scope out the work that needs to be done and to help kind of make items more actionable within your strategic plan. So now that we've talked about an aim statement, we're going to relate this back to and tie it into how key performance indicators can help in building out some of your strategic plan as well. So a key performance indicator, those are the qualifiable measures of performance over time for a specific objective. While aim statements can really help you define what success looks like at a higher level, key performance indicators can help you track progress towards specific strategic goals. Typically, key performance indicators are tied to a larger strategic objective or a strategic organizational goal. And we'll explore some of these in examples later on in this presentation. But you really want to just get down to the nitty-gritty of what a KPI should include. And that is, a KPI should really be realistic, straightforward, and easy to measure. It should be aligned with overall organizational strategy and outcomes. And this means that the overarching aims and goals should be really what informs your KPI. A KPI should also be actionable. And so this means that once you've set your key performance indicator, you'll need to outline the steps that you'll take in order for you to reach it and the metrics that you'll measure along the way. It should also be realistic. Good advice is to really start small. You know, while big, lofty KPIs, they may really look good on paper, they really aren't doing your team any favors if they're unrealistic from the get-go. And so you really want to make sure that in thinking about the scope of your organization, the scope of your work, that your key performance indicator is realistic and able to attain. And that leads us to the last one, which is that your KPI should be measurable. And so when you set your KPIs, you really want to ask yourself, you know, what are you trying to achieve? What is the desired end result? And what's the timeline in which you're trying to achieve it in? You really want to remember to add, how am I going to measure my KPIs? And so really that is a really crucial and key element of developing a key performance indicator, is also being able to say, okay, this indicator can be measured to some extent. And you also might be hearing this and thinking, you know, how is this any different from evaluations? Well, we will explore this in the next slide, but on high, like we were talking about with aim statements, key performance indicators really provide another high level and typically relate to overall strategic organizational goals, while your evaluations might focus on more specific and get into the programmatic activities and capture more of that information on some of your operations and impact. And so when we're thinking about, defining key performance indicators from a metric, you want to think about, key performance indicators are those specific measurable goals. And so they can be identified as a SMART goal, which means that they're specific, measurable, achievable, realistic, and timely. And as you can see, all of those kind of tie back into the necessary elements that are needed in order for you to have a KPI and developing your KPI. And it should also really give you a holistic view of where you stand related to your goals. A metric is really a way to track your progress towards those goals. And so you want to think about the metric as a way to track your key performance indicator. And it's really tied to specific activity and typically relates to the ongoing day-to-day processes. There are two different types of KPIs too. And so the first one is process oriented. And this just means that it really focuses on the key inputs to a process. And so when we're thinking back to our case study, we can think about a process oriented KPI as the time it takes for a new parent to be scheduled for their postpartum visit to when they actually receive the visit. And so you really want to focus on what are the inputs needed in order for you to get to that process or in order for it to be included in the process. Whereas results oriented, they really focus on the outputs to a process and are related to critical success factors, which we'll dive into in the next slide. But an example of this might be, using customer complaints to drive changes in your organization. And so these two are really good ways for you to distinguish between KPIs and building them into your strategic plan. But oftentimes you'll probably find yourself using results-oriented KPIs. So now we're thinking about, we've built out our aim statement, we've understood a key performance indicator, and we're going to be talking about how critical success factors are the elements that help in building out a successful strategy. So a critical success factor should reflect the voice of the customer, and you want to think of it as the element needed in order for your strategy to be successful. A KPI measures the effectiveness of achieving the objective. You want to think about a KPI as basically a report card on how well you've done, whereas the critical success factor will help in driving that KPI. So it'll help you create the elements necessary in order for you to achieve your goal. And so that's why we want to look at it as more process oriented, because it's the process that you need to get right to achieve the goal. And it really overall should improve the delivery of performance of your organization. And so this diagram can help you see where these two relate. The critical success factor and the key performance indicator will overall build a successful strategy. So now we have a KPI tree. So a KPI tree is really just a visualization of everything that we just talked about. For some of us, we are very much visual learners. I know that I am myself. And so using a KPI tree, it really allows you to see what critical success factors and KPIs are being used to measure success related to your organization. It can also really allow you to visualize, the complex relationships and interdependencies within an organization. In this example, we've provided using the strategic plan, but sometimes you'll see even a KPI tree is used to help in providing a breakdown on the organizational staff and how staff is organized. And so in this example, though, we're going to focus more so on using it to build out your strategic plan. And so at the top here, you'll see your overall aim. And so here's where you'll probably, and most likely, in most cases, include your aim statement. But sometimes it can also be the buckets of work that you will be focusing on. But you want to make sure that you have your overall aim at the very top. And then within that, you have that strategic objective. And so sometimes these are interchangeable between when you see strategic plans, it might be your goals or your focus areas. But overall, you want to include your strategic objective in this area. And then in thinking about the objective, you want to include the critical success factors. So that is, what are the key elements necessary in order for you to achieve this objective? And then using your critical success factor, you'll build out, what are some of those key measures necessary in order for you to track the progress and track to see if your critical success factor is successful. And then lastly, you'll see down here the data to be collected. And so that's kind of where that metric comes back in. And you'll see where the key performance indicator will give you a direct explanation of what metric or what data you're collecting. And so, to summarize all of what was just shared really quickly, you want to really make sure that your key performance indicator measures your strategic goals. So you want to make sure that it aligns with your strategic goals. And this can be using an aim statement to help you develop a new strategic goal, or using an aim statement to tie into a current strategic goal your organization has already created. And sometimes, we've created strategic goals, but we're unsure of how we're measuring the success. And so you can use these processes to really help you go back and figure out how and what are the elements in order for you to call this goal successful. You want to really also make sure to keep them concise, realistic, and clear cut. Everyone in your organization should really be able to understand the key performance indicator measures. And here is where you really want to hone in on the fact that data literacy is key. And then lastly, you just want to avoid KPI overload. So this really just means, including the necessary steps in the initial planning stages during your strategic planning. Sometimes this can really be a good place to see where staff roles or current measures may intersect and interact within each other. And then also sometimes it might be very beneficial for you to list out all KPI measures that you see related to some of your critical success factors. So that way you can understand or maybe consolidate and remove measures that you don't really see as aiming towards understanding how and if your goal was successful. So you want to ask yourself here, will this measure help determine if our strategic objective or goal is successful overall? So now that we have an understanding of aim statements, of key performance indicators, of critical success factors, and how each one of them kind of line up in their own process and connect back to each other, we're going to connect key performance indicators to strategic planning. And so using the chat box, I want you all to I'll give you all like a minute. I know that it's a little bit small on the screen, but when you look at these three different strategic plans, what is something that you see they all have in common? And so using the chat, you can feel free to drop in your answer. What do these strategic plans all have in common? Yep. I see clear goals, strategies, measurable goals, logic model. Yep. That's a good one. I didn't think about that. Goals and strategies, they address health inequities. Yep, that's very true. They do. Yeah, you all are all on the same path, but they all do address inequities. They appear to be like a logic model, but really they also focus in on goals and strategies. And so when you look at the structure of all of these strategic plans, you'll see that you have an overarching objective or an overarching goal, and within it you have strategies or goals to break down how you're going to achieve it. And so we can even think about this back to the aim statements, right? How we've built out an aim statement. And then within our aim statement, we've built out some of these strategies to help us achieve it. And so we can use this type of structure to really go back and add in critical success factors, which were the elements that you'll need in order to identify if, for instance, if we look at the one on the left about racial and health equity, we can use critical success factors to see if the strategies created within each bucket are um, are needed to be successful. And so you'll see that throughout when you look at strategic plans, there's always this kind of similarity in structure. You'll always see that there's this bucket, you'll see there are these goals, and then you'll see that within these goals, you have smaller strategies or smaller objectives. And so I wanted to share that with you all because I think it's important in understanding the structure in order for us to understand how you can apply KPIs and the critical success factors. And so I wanted to use an example from AmChip's strategic plan. And you'll see here that I took it directly from our communications and branding bucket. And so goal one states that it wants to expand AmChip's brand and work recognition in the maternal and child health field so that our organization is known beyond our members, partners, and collaborators, and ensure that our communications reach audiences across a variety of sectors. And so when we think back on the relationship between a key performance indicator and a critical success factor, we learned that a critical success factor is the process you need to achieve the objective, and the KPI will measure the effectiveness of achieving the objective. And so if we wanted to build out some critical success factors using our KPI tree, the first question you might want to ask yourself is, what are the elements necessary in order for this goal within the communications and branding bucket to be successful? And so we said, okay, our aim is that we really want to implement these communication goals by 2027. Within that, we've created our strategic objective, which is goal number one. And we thought about, okay, how can we expand AmChip's brand beyond our members? How can we think about including folks outside of the field so that way they can get an awareness of some of the work that we do? And we said, well, the first critical success factor that we might want to include is increase followers by 20% on all social media platforms to increase AmChip's brand awareness. Great. So with that, we've identified a process that we might need in order to be successful. So thinking about this now, we can look back and we can say, okay, what measures might be useful for us to track if we've gotten to that 20% increase? And we said, well, the first thing we want to do is look at the number of current followers on LinkedIn, Instagram, and Twitter pages. And so here you'll see that we built it out and each one connects to each other, and you can see the connections between the two. And through our key performance indicator, we can see, okay, the data to be collected with this is going to be seeing if there is a difference between the number of current followers from this year to the number of current followers in 2027, and is that difference equal to that 20% increase that we wanted to see? So by just asking ourselves, what is the process that we wanted to, and we needed in order to get this goal correctly or to define this goal as successful, we were able to use all of these elements and see the connection between the two. So now we want to go back to our case study. We want to look back and see, okay, we've identified what we want to include back in our strategic plan. Now, how can we include the KPIs, the aim statements, and our critical success factors? And so if we go back to our aim statement, we said that we wanted to increase the percentage of clients receiving postpartum doula services. Why? Because providers at 5 hospital partner sites reported low numbers of attendance of postpartum well visits. And then we've also included our WHO, which was saying that we wanted to collaborate with new parents, postpartum doulas, and providers, and do this by 2025. So in our case study example, we said, okay, our overall aim is that all clients receiving care at the 5 hospital sites will also receive postpartum well visit 3 weeks after birth. So if we look at our strategic objectives, we said that, okay, the 2 objectives that right now we want to include in the strategic plan is that all clients attend and receive their postpartum visit in the 2024 to 2025 year. And then also all providers must receive training on your organization's partnership with the hospital and the role of postpartum doulas during well visits. So you see that, on one side, we want to make sure clients have that well visit. And then on the other side, we want to educate providers on why it's important for them to follow up and why our partnership is going to be beneficial to them to help with bridging some of this lost in care. And so the first critical success factor we've identified is that we've said that, okay, in order for strategy one to be successful, all clients have a postpartum doula. And so how are we going to measure the objective? We said that we're going to use a KPI of percent of clients that are scheduled for a well visit 3 weeks after birth. And then we also said another critical success factor is that we want to make sure that there's a timely rescheduling of no-shows. So we said our KPI will be the percent of no-show appointments that are rescheduled within 72 hours by the provider. But we also want to measure the percentage of no-show clients contacted within 72 hours by the postpartum doula. So with this, we've said that we've identified two elements that are going to help us in tracking whether or not all clients attend and also receive their postpartum visit by 2025. So next, in our strategic objective number 2, we identified our critical success factor of at least 60% of postpartum doulas have been trained to educate providers. And in order for us to measure if this objective is effective, we said that the percent of postpartum doulas trained to teach providers, and we'll also be tracking the percent of postpartum doulas that opt out of training. Another critical success factor is that all providers partnered within the organization have been trained at least 2 weeks prior to the scheduled well visit with the patient. And in order for us to track and measure this objective, we said that we're going to collect the number of providers trained by well visit date. We're going to collect information on the number of partners untrained by well visit date. We're going to collect the number of providers attend that well visit training, and then the number of providers that never attend training before. And so in this, you see that, we've identified the elements needed for us to be successful, and then we've also identified the measures needed in order for us to track these goals. And so if we wanted to kind of visualize the connection between everything and the goals that we've made, we say that we can build it out into a KPI tree. And so it's exactly the same information that you just saw, but you'll see that we have our overall aim, we have our strategic objective, our critical success factors, and then the KPIs that we'll use to measure that. And so now we want to take it back to you all. And thinking about, some ways in which over time we'll always be kind of adding to or editing and revising our strategic goals. And so you realize that after speaking with your client, parents are attending their visit, but some are not being seen and instead asked to reschedule because appointments were double booked on the provider side. So your team decides to go back and add a new critical success factor into your strategic plan to adjust how and why provider offices are double booking clients. And so we want you all to explore and see and build out your own critical success factor. And so the first question is, what critical success factor might you create to track this issue of double booking that's happening on the provider side? And then what key performance indicator will you use to measure your critical success factor? And so using the chat, I'll give you all some time to build that out, but just want to remind you all that when we think about a critical success factor, the critical success factor is the element you need in order for you to be successful. And your key performance indicator is the measure that you'll use to track your objective and your critical success factor. And so for this example, you're going to build out a critical success factor that defines what success looks like if parents are being able to attend their well visits when they're scheduled to and tracking that information. And then your key performance indicator is going to use the measurement that you will use to track your critical success factor. So I'll give you all a minute until, yeah, 3:31. Okay, I know that one might have been a hard one, so I might also just give y'all a little hint, which is an example that we created. And so, oops. So if you're thinking about, okay, thank you, Todd. Todd said that a critical success factor is that all scheduled patients are seen. Yep, that's it. That's a good one. And so if you're thinking about all patients being seen, a key performance indicator might be, the number of patients that are seen on their appointment date, and another one might be the number of patients that are not seen on their appointment date. We've also provided an example here where a critical success factor might be that all clients report that they were seen by provider on their appointment date, which was basically the one that Todd shared. And some KPIs related to that might be the percent of clients that report not being seen by the provider, the percent of clients that provider reschedules on the appointment date, and the percent of clients that were actually never rescheduled. And so you'll see here that, this can always be used interchangeably. Sometimes you'll see that there might be whole numbers that you want to collect versus the percentage. But it's really up to you and your organization to define which one will be beneficial to your strategic plan overall. So now I'm going to pass it to Laura for her to give us a little bit of an overview on how theory of change can apply to some of what was just shared.
Thanks, Salome. Um, so that was a lot of amazing, great, useful information that Salome shared. And you might be thinking, how do I go about building this out? How do I go about applying this? And so we wanted to offer for you one framework kind of tool that can be really helpful in articulating some of these, both the key performance indicators as well as the CSFs that you might want to be thinking about. So we're going to talk a little bit now about a theory of change. Next slide, please. So first of all, what is a theory of change? So a theory of change is a comprehensive description and illustration of how and why a desired change is expected to happen in a particular context. If you want to click forward. It really charts out the work ahead, what success looks like, and how to get there. So I really like to think about theory of changes as a blueprint. Similar to a logic model, I would say they're cousins. They're very related in sort of the structure, but there are some different elements to a theory of change, and theory of change can often also have a little bit more of a visual component to it. And why is it important for strategic planning? So it is a really strong basis for measurement, experimentation, and learning. So really what that means is your theory of change can be very, very helpful in establishing your evaluation plan. You'll want to build your plan off of your theory of change often. And then in terms of that experimentation and learning piece, just like Salome was mentioning, that you have KPIs related to process and outcomes. You can have both process and outcome measures built into your theory of change. So they can be really critical for that kind of continuous quality improvement and making sure that you are thinking about and learning from your approaches. So theory of change can also help teams test assumptions related to adapting and implementing strategies and clarify complicated pathways to change. So it's really, really helpful for kind of these complex systems change work, which is often what we're doing in the public health space. It can be helpful. We'll talk a bit more in a moment about assumptions, but like I said, it really serves as a blueprint or a compass illuminating the desired goals, informing adaptations, and identifying opportunities for meaningful measurement. Next slide, please. So it's really important to note there is no one right way to make a theory of change. There is no one template. We offer one in our resource directory for you all to use, but there are so many different ways to build out a theory of change, and a lot of them, they're all right. They all are really just tailored to meet the individual needs of the organization that you are building up the theory of change for the project that you're building up the theory of change for. But that said, some common key elements to theories of change are some sort of an aim statement or overarching kind of desired outcome state that you're moving towards. So you can absolutely use the aim statement that we kind of taught you how to draft earlier on when it comes to your own theory of change. It also can articulate guiding foundations and principles. So these can be sort of key values for your organization. So for example, it might be that you, a key guiding foundation or principle for your organization is that you are trying to center and uplift lived experience. It could also be that you're trying to center human-centered design, or that you're trying to be warm, like create a sense of warmth and compassion in your work. So these guiding principles, we'll talk more about this. It could be a commitment to health equity or racial equity. They really serve as establishing kind of the ethos, the culture of your organization. And so they can be helpful in articulating in that way too, especially I find when it comes to onboarding new folks, kind of help them understand not just the what of what you're going to be doing, but how, and the kind of energy that you're bringing to, and the lens through which you're approaching your work. Next up are, go back. Next up are working assumptions. So working assumptions, these can be kind of the conditions that you're expecting for your theory of change to hold. So for example, if you were to build out a theory of change, you might assume that if you are doing like a policy related initiative, right, you might make the assumption that like elections are going to happen during the time that they always happen. That's an assumption that you might make that is going to impact your kind of theory of change, and if what you are proposing is going to occur. Another one could be you're assuming that you'll have funding or you'll receive future funding or things like that when it comes to sustainability. An example of this not being met would have been the pandemic, right? I know a lot of programs, almost every program in some capacity, their theory of change or what they were anticipating how the work would be done changed in a pretty significant way because of the pandemic. That would be an example of kind of those working assumptions not being met. And it can be helpful to articulate because it can show, it helps you to understand maybe some of these assumptions were wrong. If you're not seeing the outcomes that you're hoping to see, maybe it actually is also about the assumptions. Maybe you've made some incorrect assumptions, and that's why you're not seeing the results you thought you would. Another core component is strategies and activities. So these really are the what, right? The what it is of what your different program is doing. And so you'll see in a couple different examples ways that those can be illuminated for your theory of change. You have your outcomes, so thinking both short and long term. And then you have your goals and impact. So this is kind of the overall, like, 30,000 foot level ultimate thing that you're working towards through your different initiatives. So like I said, there's no one way to do a theory of change. So we're going to go over a few different examples here just to kind of show you some of the diversity and how different folks approach it. Next slide, please. So this is one example of a theory of change for the kind of iHealth system. So what I liked about this one is you see that at the bottom there, it's a little bit small on my screen, but hopefully you're able to see. At the bottom there, they really have their foundational values, right? So they have gender equity, social inclusion, accountability, health system strengthening, sustainability, value for money. So different things that underpin these activities from like a values perspective. And I think this theory of change example really outlines that well. You also see, so they have their strategies or activities and the what do they do. So they outline their 4 key strategies. They have their short-term outcomes, long-term outcomes, the impact they're hoping to have, and then sort of the overall systems change that they're going to be seeing. Another thing to highlight about this that can be helpful is they map on for the activities how each of these activities contribute to specific outcomes. Not everyone does it that way, as we'll see in a moment, but that is definitely one option of a way to do that. Next slide, please. So this next example is, I really liked this one as well because I think it helps to illustrate how you can really build out your whole theory of change based on your specific strategies. So for this one, it talks about learning, success, and community. And so it breaks up short, intermediate, and long-term goals, and then their overall vision, and kind of shows how these all contribute. I also like how this breaks it up by population in a really clear visual way. Sometimes in a logic model that can get a little bit muddled. So that might be if you're like, how do I pick between building a logic model or a theory of change? That's one way that you can kind of think about and consider it. Next slide, please. So this next one, right off the bat, it is very visual. It's a little more creative, a little more of a story is told. Even though it's not articulating the values, you get a bit of a sense of some of the values based on the images and the imagery that they're choosing to include. So there is that visual element too to the theory of change that you can use here. And again, this one really, this isn't my favorite one. It's a little bit confusing to see, I think, in terms of the outcomes piece, like what is leading to what. I think they've tried with the arrows to indicate that, but I just think it's a little bit busy, so it's hard to tell. But I do, again, like that they break it up by population. And you'll note that they kind of under their population domains, like especially for the among family schools and community-based orgs, they talk about kind of that positive change or fewer or increased or more. So oftentimes there will be a directionality included with the different outcome elements in the theory of change, which can be helpful. Next slide, please. This one I really liked and wanted to highlight because I feel like it does a really great job emphasizing how your theory of change can help show the values that your work are rooted in. So for them, it's these 7 key principles, right, of parent and community engagement, cultural learning space, self-determination, root issues, action research, value-driven approaches, and literacy and identity connections. And I really liked this one too because it just kind of shows how the work grows up from that. So it's not, doesn't always have to be kind of horizontal across. There's really a lot of room, again, for creativity with theory of change, ways that you can really describe your individual programs like goals. Next, please. And then the last one I wanted to show you is just this as an example of where there might be some critical success factors or KPIs included in a theory of change. So under this, we will achieve these conditions through these activities. You'll see that there's some different indicators there. So like you have numbers of communities at gatherings or number of people at gatherings or number of people using and requesting tools, etc. So yeah, just wanted to show all these as different examples to try to help kind of get you inspired, think about how you might be able to apply this to your own work. Next slide, please. And then coming back to our case study, we're now going to kind of go over together an example theory of change that might come into play for this organization. So again, like with your goal being focusing on identifying how your organization and providers at 5 hospitals can leverage partnerships to increase the number of postpartum visits attended by clients and new parents. Next slide, please. So in this example of a theory of change, we have our aim statement. So that was, the same aim statement that we drafted before together. Then you'll see at the bottom here, we have our guiding principles. So maybe some of the values of the organization would be health equity or being guided by lived experience, racial justice, reproductive freedom, being human-centered, having shared decision-making and collaboration. So some of these activities might be identifying partner hospitals, training and recruiting doulas. Short-term goals with that might be the establishment of partnerships with 5 hospitals. For the doulas, it could be an increase in the number of clients working with doulas. And then longer-term outcomes, we're seeing those improve maternal and infant health outcomes, having more postpartum people receiving doula services, and then there being more MCH system coordination. The IME over there on the right, those also can be helpful sometimes if you want to characterize, is this an internal goal or an external goal? So kind of thinking about those process or outcome related KPIs or measures can be really useful there. But this one's a little rudimentary, but just wanted to show that this is kind of an example of how this could help pull together a lot of what Salome was presenting on earlier. Next slide, please. And that is it in terms of new content that we have for you today. Just really wanted to emphasize some upcoming opportunities. We have our next quarterly webinar will be happening in a few months. And then happening in June, we're excited about our collaboration circle, which is an opportunity to dig deeper into programmatic experiences, challenges, and to learn from other IHLC members. Next slide, please. And this is just a snapshot of our upcoming webinars. So our next one will be in late August on qualitative research and interviewing considerations. So with that, I welcome any questions that folks have. We're happy to stay on and answer those. And yeah, just thank you so much for your engagement and for your time today. So with that, are there any questions? And I'll call out too that Noelle has chatted in the link for the collaboration circle, as well as a link to our kind of overall innovation hub link tree.
And you should also see the evaluation pop up as well.
Yes, Melissa, to your question, do you offer TA to assist with amending or creating strategic plans? We do. Yep. So through the Learning Hub community, if you have work in Innovation Hub, especially, like, that is something we definitely offer support with. So if that's something you'd be interested in, you can either reach out to us directly at our emails are just our first initial and last name at AmChip, or the evidence and implement, or the evidence at AmChip email is also a great place, and you'll get connected with us through that.
And we will also be sharing, some additional resources and these slides early next week. So be on the lookout for that. That'll give you information on how you can reach out to us and information on the collaborative circle session if you want to register to attend that. Ooh, are there any more questions? Oh, if there are no more questions, if you haven't completed the evaluation, please do so. But if not, like I said, we'll be reaching out to you all. So you can feel free to email us if anything comes up. And we really appreciate you all joining us today, and hope that it was a lot of information, but I hope that some of it was able to sink in for you. So thank you. And thank you, Laura, as well, for your input today. Thank you, Todd.
Everyone.